I'm Dr. Farida Kaittany, consultant physician gastroenterologist, and today I would like to talk about a common problem, something very common in our society, what people call H. pylori, in full terms Helicobacter pylori infection. This is a very common bacteria in our population. It is transmitted through contaminated food and water, and unlike what most people in the community think, most people with H. pylori infections have no symptoms. But a small proportion of patients who have H. pylori infection get symptoms. And some of these symptoms include pain in the upper part of the abdomen. It can cause a dropping blood count, anemia, and also vomiting. Okay. So this H. pylori, for those patients who have infection, it may lead to irritation of the lining of the stomach, what doctors call gastritis. It may also lead to peptic ulcer disease, and in some very rare occasion may lead to changes in the lining of the stomach that can predispose to stomach cancer. If you're told that you're having H. pylori infection, that is why you keep getting recurrent diarrhea, that may not be true, because the bacteria tends to live only in the stomach and doesn't affect the small intestines or the large intestines. So it is not responsible for symptoms like diarrhea, headaches, okay? And if you have symptoms, for example, you're losing weight, you're vomiting persistently, you have anemia, you've been treated for H. pylori, you're not getting better, or you have somebody in the family who has stomach cancer. If you have been given a diagnosis of H. pylori and you have any of those symptoms, you should seek further attention, because in this situation, you may need to get to do an endoscopy so that we determine if there is more than the H. pylori infection causing your symptoms. So this bacteria, how we commonly test it is through stool. We look for parts of the fragments of the bacteria in your stool. Or sometimes, if your doctor is doing an endoscopy, which is a procedure to look into your stomach, they may get a piece of tissue from your stomach lining and be able to detect the bacteria from the stomach lining. Those are the two common ways we detect H. pylori infection in our populations. So the treatment for H. pylori usually is a combination of antibiotics that your doctor will select based on your previous exposure to antibiotics, and also based on the which antibiotics work best in your population, and a combination of an acid suppressing medication. And the treatment is for 14 days, so a long duration of treatment. This bacteria can be difficult to eradicate, so it is important to stay the course of treatment for 14 days. And if you're having any major side effects and cannot tolerate the antibiotics that your doctor has prescribed, it may be wise in that situation to go back to your doctor and see if they can give you a change in medication. But the duration of treatment should be 14 days. Anything shorter than that is likely to not successfully clear the bacteria. Yes, so one common question that patient asks all the time is, why do I get reinfected with H. pylori all the time? More often than not, it is not a reinfection. More often than not, it is the infection that did not get cleared. And why would an infection not get cleared? That's because in our population, we have some drug resistance to some of the common antibiotics that we use for eradicating the H. pylori. For example, amoxicillin, clarithromycin. These are antibiotics that if you're keen, you'll notice that they do tend to get abused in the population. If you're not clearing your infection, it keeps being positive in the stool, then you should seek help from your doctor so that they can switch you to a different line of antibiotics that may be more sensitive for clearing the infection. Another important question to ask is, when should I get an endoscopy if I'm having symptoms that suggest H. pylori infection? One is if you're vomiting persistently, if you're losing weight with abdominal pain, if you're developing anemia and have abdominal pain, if you're receiving treatment for H. pylori and you're not getting better, your symptoms are not improving, and also if the H. pylori is remaining persistently positive, you may need an endoscopy so that your doctor is able to get a biopsy from your stomach where they can then culture the bacteria and tell which strains of antibiotics would work well for you.